Alrighty. Hello, everyone, and good morning. Thank you for joining us for our virtual open enrollment seminar. At this time, we will go over United Healthcare medical benefits for plan year 2026. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. Should you have a question, please type it in the chat box located on the right-hand side of the presentation screen. And kindly be informed that if you do type a question in that chat box, everyone attending the session will see your question along with your name. So if you have a question that is sensitive or confidential, we recommend that you reach out to the County Benefits Division or your department's benefits ambassador. Lastly, today's seminar is being recorded and a copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Matt Ogden.
Thank you so much, Nidra. I appreciate it. Good afternoon, everyone. My name is Matt Ogden. I am your dedicated account manager for the County of San Diego, and I am an account manager with VEBA. Today, we are going to go ahead and talk about your open enrollment options for you today. So for today's agenda, we're going to talk a little bit about what's going to be changing for 2026. Then we're going to have the carriers talk about the available benefits. So those are the plans that are going to be offered. And then we're going to talk about some of the additional resources that are available to you. So that includes our VEBA Resource Center, some of the additional resources, our health and well-being resources, and then some of the additional resources that are available. If you do have any questions, we are kindly asking you to stay muted throughout the entire presentation. If you'd please be so kind to put those into the chat, then we will be more than happy to go ahead and answer all of your questions at the end of the presentation or respond to you via the chat. All right, so let's start with, who is VEBA? What is VEBA? So VEBA is actually a third-party administrator. It's actually a nonprofit trust that provides healthcare benefits for different groups that are out there. And the County of San Diego is one of those groups that we provide your healthcare benefits. And when it really comes to your benefits, your health, our purpose is really solely what drives us. You, the members, are first and foremost our primary objective. We want to make sure that you guys are being awarded the very best healthcare that is out there in the industry and that you get it at the most affordable cost. So your health, our purpose is really our mission statement that drives us to just strive what we do each and every day. And that's really to give you the opportunity to have the very best healthcare possible. With our vision at California Schools, our vision is to have all Californians have accessible and equitable healthcare. And our mission statement is to build strong communities through a healthy, engaged, and emboldened membership that enjoys a total state of well-being. So let's go into what's going to change for the 2026 plan year. This is going to take effect on January 1st, 2026. The first one is going to be with regards to the new fertility mandate. This is also known as the California State Mandate, or SB 729. So what's changing is that basically the California law is now requiring that all fully insured plans are now offering infertility services. So this includes the diagnosis of infertility as well as the infertility benefits themselves. These are going to be embedded into any fully insured medical plans. I'll go through that here in a minute, but it is going to be required that anyone that's enrolled into the UnitedHealthcare plans, the SIMSA plan, or the UMR PPO plan does have infertility services that are embedded into these plans. And so that includes services like IVF and IUI. The carrier partners are going to talk a little bit more about how that's going to impact you. But what does that exactly mean for Kindbody? So Kindbody, we were actually ahead of the curve a couple years ago, and we offered infertility services for any members that were enrolled into the UnitedHealthcare HMO plan offerings, as well as the UMR PPO offering. We were offering and paying one full Kind cycle, so one round of IVF or one round of IUI that was separate from your actual medical benefit plan. Now, because of the state mandate, then basically all of your IVF, IUI, infertility services are going to be done directly through your carrier partner. So you're going to go through your doctor's office, you're going to go through your medical group in order to receive these type of services. But with KindBody, there's a lot of additional services that are available that were included that would no longer be part of the infertility services. But we wanted to make sure that you still have access to these services under KindBody. So if you're enrolled into the UnitedHealthcare HMO plans, then basically you will still have the access to a lot of their additional resources. These included their holistic services that they offered, as well as a menopause benefit. There was virtual services that they had surrounding menopause, and these are not services that are covered under your medical plan. So we want to make sure that you still have access to these services. So if you are looking to seek any type of menopause services or holistic health services through KindBody, this will still be covered moving forward into 2026. In addition, you're going to have access to 3 new services through KindBody as well. This is Kind Man, Kind Doula, and fertility preservation. So Kind Man, basically there were no services that were covered under the male side when it comes to infertility. So moving forward, then there are going to be male diagnostic infertility services that are available. You can reach out to KindBody, and if there are any services surrounding infertility through KindBody that are needed, that will be covered and paid for by VEBA. Kind Doula is actually a virtual care program that offers doula services. So anyone that is actually going through the pregnancy process and you need additional support, additional resources, then we are offering 8 virtual care services, 8 doula services with one of the doula specialists at no cost. Should you want to seek in-person doula services, you would just be responsible for paying that out of pocket, but we will go ahead and pay for and sponsor 8 virtual care sessions with a doula specialist for any families that are going through the pregnancy process. And then finally, with fertility preservation. So if you want to have your eggs frozen or your sperm frozen or your embryos frozen, then we will go ahead and pay and sponsor the first year of having that fertility preservation. If you want to have it, your eggs or your sperm frozen for multiple years, then you can go ahead and do so. You would just be responsible for the additional years. I think that the going rate right now is approximately about $900. And then if you want to continue to use KindBody services, if you want to, starting in 2026, you decide, hey, I want to grow my family. I actually don't want to go through my medical provider. Instead, I would rather go through KindBody. You can do so. You'll just be responsible for the cost, but we are awarding you with a 20% discount through KindBody. And so that's rounds of IVF and IUI where you can actually get a discounted rate for infertility services directly through KindBody. Otherwise, moving forward in 2026, then you can go ahead and go through your medical provider as this will be covered under your medical plan. Now, for any members that are currently accessing KindBody, so right now maybe you're working with KindBody, you're looking to grow your family, you're going through IVF or IUI, or maybe you're thinking about doing so in the next month or two, and it carries over into 2026, then there is a continuity of care that is in place where we will actually continue to allow you to partner with KindBody and still receive all of their services through Q1 of 2026. So you will have access till the end of March of 2026 if you begin your infertility service quest in the 2025 plan year. If you wait till 1/1 of 2026, you can go ahead and do so. You will just be accessing infertility services directly through your medical provider. So this is for anyone that's enrolled into the UnitedHealthcare HMO plans. So what about your members that, or what about members that are enrolled into the PPO plan? So this is through UMR. Well, UMR is actually a self-service plan and is not mandated by SB 729. So we wanted to make sure that, with UMR members, they do not have access to infertility benefits through their medical plan. Instead, what we are doing is we're going to continue to partner with KindBody, where members will still receive that one full kind cycle of IVF or IUI if you're enrolled into the UMR PPO plan. You're still going to get the additional services through Kind Body, like Kind Man, Kind Doula, and fertility preservation, just like the members that are on the HMO plans. But what we're also going to include is instead of having one round of IVF or IUI, we're actually going to bump that up to 3 lifetime cycles. So instead of having one lifetime cycle, VEBA will actually pay and sponsor 3 lifetime cycles. So either 3 rounds of IVF or IUI if you're enrolled into the UMR PPO plan. The Surest plan is also for any of your members that are enrolled into the HMO plans who have dependent students that are maybe going away to college. We put them on the Surest plan. This is also a self-insured plan where infertility services are not covered. So members that are any members that have dependent students, maybe they're going away to college, they're looking to grow their families, and they're enrolled into the Surest platform, they can get those 3 rounds of IVF and IUI as well. So just to recap, for the PPO members, then we're going to bump up the rounds of IVF and IUI to 3 full Kind cycles. You get the additional resources through Kind Body, and all of your fertility treatment is going to go through Kind Body. For members that are enrolled into the UnitedHealthcare HMO plans, then infertility is no longer going to be covered through Kind Body. Instead, it's going to be covered under your medical plan. So you will go through your medical provider for the 2026 plan year. With that being said, then I'm going to turn it over to UnitedHealthcare. We're going to begin by going over the different plans that are available to you in the 2026 plan year. With that being said, I'd like to turn it over to Nick Cruz with UnitedHealthcare. Nick, it is all yours.
Thank you, Matt, and good morning, everyone. My name is Nick Cruz, and I am with UnitedHealthcare, and I have the pleasure of going over your UnitedHealthcare benefits today. So during open enrollment, we always like to start with some of the HMO overview and requirements, some of the things that you need to know as a member of the HMO UnitedHealthcare plans. So during open enrollment, while you're selecting a plan, one of the requirements, or members are required to choose a primary care physician. You do need to select a primary care physician from the network of doctors that are available, again, under the network that you select. So we'll go over the different networks here in just a moment, and then you'll see a snapshot of some of those medical groups that are available. But again, you do need to select a primary care physician from within your network. Again, once you make that selection and a network decision during open enrollment, that is locked in for the year. There is one exception to that, and that's, of course, qualifying events. UnitedHealthcare does support qualifying event changes throughout the year. And as long as one of those qualifying events, or you're eligible for a qualifying event, you can change. However, if you're not, you will be locked in for that year. Now, when it comes to selecting a primary care physician or a medical group in general, one thing that we like to call out is that members are able to have have different medical groups within the same network. And that basically means that, let's say, a subscriber and their dependent can be on different medical groups. So for instance, on the Performance Network, a member could be a part of a Sharp physician and medical group, and then they can have a dependent on Radies. So that is allowed within the same medical group. One good thing about medical groups and primary care physician changes, they're allowed within the plan network at any time throughout the year. You simply can call into UnitedHealthcare, the member services, or even go on to the member app in order to make a primary care physician change or request one. They do follow what we call the 15-30-day rule. So you'll want to call in before the 15th of the month to get that change processed for the first of the following month, but you can make those changes at any time. All right, so here we're jumping into the first design here, the network design, and this is the VEBA Performance Network. So good thing here for members who are familiar with this plan, there are no changes happening on this plan. So it will stay the same. So as you can see on the left-hand side is a breakdown of the performance plan, and you'll have, of course, there's no deductible on the plan. There's an out-of-pocket limit for a single individual of $2,000 and a family of $6,000. Your copays will be a $25 copay for both your primary care physician and a specialist. If you are admitted into the hospital, you have a $200 copay, and for an emergency room visit, it is a $125 copay. And then, of course, your urgent cares will match the primary care physician and specialist copay of $25. And then, if you are utilizing the virtual visit benefit, now the virtual visit benefit, of course, is the options, three options that are through UnitedHealthcare, which I'll cover here in a few slides. That is no charge. Telehealth visits through your actual primary care physician do follow your primary care physician copay of $25. And then on the right, of course, you'll see some of the list of the available medical groups that are in the San Diego County. So you'll see, of course, you'll have Sharp and all of the various Sharp medical group affiliates that are available, including Sharp Reese Dilly, as well as Optum Care, and then Rady's Children. So again, this is just a snapshot of the VEBA Performance Network. And then if we jump into the next slide, you'll see a breakdown of the Alliance Network. So the Alliance is another option that's available to members. Again, here, there are no changes on the Alliance plan. The Alliance plan and the copays are very similar with one slight difference. So you'll see again on the deductible, there's no deductible. Out-of-pocket limit, $2,000 for an individual, $6,000 for a family. Primary care physician visit is $25 copay, but for your specialist, which is the difference between the and the copay, is a $40 copay there. Of course, again, the hospital, if you are admitted into the hospital, it's a $200 copay. The ER visit is $125, urgent care $25, and virtual visits is no charge. So where you will see some of the difference here between the two is the network. So in the network and the medical groups that are available, you'll see that Sharp is not available under Alliance. However, Scripps is available. So you'll see Scripps Clinic, Scripps Coastal, and Scripps Physicians available, along with, again, Radius is still available, and UCSD as well. So that's just some of the, again, specific to the San Diego area, of the differences that are there between the two. Next slide. So next we have the Harmony High Deductible Health Plan. So this plan is an HSA compatible high deductible health plan. One thing that we like to call out on this plan is the medical and the RX accumulators are combined. And basically what that means is your RX copays from Express Scripts are included in the deductible and out-of-pocket limits that are on this plan. So as you can see on the left here, when you look at one of the differences on this plan is there is a deductible for this plan. For an individual, the deductible is a $2,700. And on the family, the deductible is $3,400. For the out-of-pocket limit is $3,400 for both the individual. And then on the family plan, for an individual on the family plan, it's $3,400, and for the family, it's $6,000. All right. So, and then of course, when you're looking at the rest of the benefits, you have your primary care physician visit, your specialist, hospital stay, and ER. All of those will be 10% copayment after the deductible. And basically what that means is after you meet your deductible, whichever applies for your particular plan, whether it's the $2,700 or the $34,000, you will be responsible for 10%, meaning UnitedHealthcare would pay the 90% for the coverage after, again, you meet the deductible. One change on this plan is for the virtual visits. So the virtual visits, again, the virtual visit options through UnitedHealthcare, not your actual telehealth visits through the medical group. There are no charge for virtual visits. So if you're utilizing the benefit that UnitedHealthcare offers for virtual visits, you will have zero charge on the copay. And then, of course, if you're looking on the right again with the breakdown of the medical groups, you'll see that Sharp is in the San Diego area. Sharp is the medical groups available on the Harmony plan, as well as Optum, Sharp Reese-Dilly, and UCSD. The one call out that I will add here is that Radius is not included in the Harmony plan. So again, Harmony. Although Sharp's here in UCSD, Radius is not on this particular plan. Next slide. Perfect. All right, so I know Matt touched on this a little bit here, but of course, we wanted to go over it and provide a little bit more detail on what's covered under the SB 729. So again, this, what does this service mean? What's covered? This is the coverage for diagnosis and treatment of infertility and fertility services. And of course, under this benefit, members will have access to 3 completed egg retrieval cycles covered underneath the benefit. Again, it's the diagnosis of infertility and IVF coverage that will be covered under this plan. Now, of course, for embryo transfers as well, there are unlimited embryo transfers as well, as long as it's medically appropriate underneath the guidelines provided. So I do want to call out that the clinical guidelines for this particular benefit are still under review. So some of the specific language and coverage for this is still pending approval by the DMHC. So we will do our best to get any and all answers, all questions answered. But some of that is still pending final approval from the DMHC. However, again, this is your basic understanding of what's going to be covered underneath this benefit now available under all of the UnitedHealthcare plans. Perfect. So out of area dependence. As you may or may not know, out of area dependence is something that's offered unique to UnitedHealthcare through VEBA, or UnitedHealthcare members through VEBA. And basically through the out of area dependence, when you have a dependent that is, let's say, going to school out of state, or they're going to school in let's say, Northern California, there are times where the coverage available on your plan may be limited, or not available. What VEBA and UnitedHealthcare does is they look at the available medical groups in the area, and if there are none available, they will move your dependent and enroll them onto a alternate plan. So for dependents within California, they are primarily moved to the full network UnitedHealthcare plan. And for all members outside of the states, meaning out of California, those dependents will all be enrolled onto the Surest PPO plan. In order to enroll your dependents on this, all you simply need to do is contact the County of San Diego benefits team, advise them of the change to your dependent's address and that they are going away to school, and they will provide that information over to VEBA, who will then enroll your dependent on the corresponding plan. The good thing about this as well is there's no cost addition to you as the member. The cost will remain the same as well. The only difference would be, of course, the specific benefit coverages would be different than their current plan that you're enrolled onto. So again, if you are looking to take advantage of this and you have a dependent that's going away to school in an out of area, please notify your County San Diego benefits team and provide the address where the member is, or your dependent, is located, and they will be enrolled onto the corresponding plan. So now, of course, with this, we wanted to provide, and Matt, you can jump to the next slide. We wanted to provide for some information in regards to the Surest plan, because the Surest plan is the new out-of-area, out-of-state, plan for the dependents. So again, Surest is this particular plan is a copay only plan with no deductibles or coinsurance, which is uniquely different from a typical PPO plan, but it is a PPO plan. This plan is basically an app-based plan where members can go on and you can search for costs and coverage directly on an app. So it is an app-based program. There is a website as well, but it is an app primarily. Again, where you can choose from providers directly for any service, and it's really made simple and easy for members to utilize. And again, There's no deductibles or coinsurance. It's a copay only plan. When members search for a specific service and they are provided a list of doctors in the given area for that service, it will provide the affiliated copay that they will be charged at the point of service. So again, this is a wonderful benefit through the Surest app, and there is also a link to where you can get an idea of the information that's available through Surest, or how the app works as well too. So Matt, if you want to jump to the next slide. So here is that. So again, that's the website or the app there. There's a QR code that you can go to. The link is benefit.surest.com, where basically you can have a preview code that you enter in. It's Cali 2025. And what that does is it enables you to go in and have a preview of exactly how the app works and how it functions. Or simply, again, you can type in a type of service that you're going to utilize. You can type in a doctor's name if you're looking for a specific doctor, which you can still do, and it will provide that if you're looking for a doctor, it'll show you the doctor and the service that what the copay would be for a specific service. Or if you're looking for just a general service, it'll give you a list of doctors and what their copay would be in order to utilize that service. So again, anybody who has a dependent who is going to be enrolled in this plan and they want to understand how it works and just get an overall visual, just that's an easy link for you to use. It's again the benefits.surest.com or the QR code there with the preview code Cali 2025. Next slide. All right. So of course, UnitedHealthcare has many ways for you to gain information and access all of the benefits that are available to you. So for any member who is looking to enroll on a UnitedHealthcare plan, they just want general information, or they want to search, let's say, for a doctor to see if they're a network on a plan. The best website for you to go to is the yuhc.com/COSD. This website is specifically for, geared towards members looking for all of that information and looking for doctors in network. So there's easy to access hyperlinks that go directly to the network. So you're simply looking at, let's say you're looking at the Alliance plan. You go to the Alliance specifically on provider link on there. You click it and it takes you directly where you need to do. Well, you can put in a zip code, you can put in a doctor's name, however it is you're searching for. Really makes it simple and easy to verify if you're looking for a specific doctor. And you can do that for any one of the given networks as well. And then of course on the there's myuhc.com. So myuhc.com is the member portal for all UnitedHealthcare members. And this is again where once you're a UnitedHealthcare member, you can access all of the benefits that are available to you. So you can view claims, referrals. If you want to change your primary care physician without making a call in, you're kind of a do-it-yourself type person, you can do that. You can access the virtual visit information in order to utilize them. And again, all of the wonderful benefits that are available through UnitedHealthcare are done primarily through MyUHC, which there's also an app as well. It's the UHC app, which you can download in the App Store. ID cards. So of course, ID cards are always a topic that we like to discuss. ID cards are available digitally to you. And again, those are available to you through the MyUHC app. The digital cards are a 100% replica of the physical card that you receive in the mail. So the good thing about the digital ID card is whenever you make a change to your plans, let's say that you change your primary care physician, or there was a change in network. Let's say you lost an ID card, whatever it is, the digital ID card is always available to you through that app. And then whenever you do make a change, the digital ID card is available to you within 48 hours of that change. It's a lot faster than the physical cards. The physical ID cards take 7 to 10 business days in order to receive them in the mail. And if you're like me and lose your ID cards for some reason all the time, it's easily available to you through the app. So again, it's a great useful tool. It's 100% replica again of the physical card. So your doctor should have no issue pulling whatever information they need off of that digital card as well. Now, I do want to call out that the hard cards will still be available whenever you make a change throughout the year. The physical cards will still be sent out in the mail. The digital ID card is again just the uh, better option and easier through the My UHC app. Um, so yeah, next slide, please. Virtual visits. So I've alluded to the virtual visits a few times. Virtual visits are included on all of the plans. There's a $0 copay on the plans for this. And again, this is utilizing the virtual visit option through UnitedHealthcare. There are 3 options for this. It's Teladoc, Doctor on Demand, and Amwell. You can access this again through the My UHC app or through the website in general. You can get access 24/7 to this service. Again, there's no waiting in a line for this. It's simple and easy. You just sign on, and you typically have you're speaking with someone within minutes. Um, and it's great for things, for the common medical diagnosis, or excuse me, common medical conditions. Or if, let's say, you're searching for simply a prescription for something, and they can send prescriptions directly through the app. So it is again a wonderful benefit to utilize, especially in those simple common medical conditions, or if you even need a doctor's note, that can be done as well. And again, everybody loves $0 copay. Next slide. OnePass. So OnePass is a gym membership benefit that's available through UnitedHealthcare. And this is, I like to call it the freedom of choice gym membership. So there are multiple options available and what we call tiers. And in these tiers of benefits, you're able to select any one of the tiers. And among those tiers, there are multiple gyms available. The good thing about this is you are able to attend and utilize any of the benefits available at any of the gyms under the tier that you select. So, for instance, let's say that I'm going to a class at LA Fitness, and I run out of classes at LA Fitness because most of the time they limit the amount of classes that you're able to have. I do my 4 classes within the month, but I still want to continue classes. Well, because Crunch Fitness is also available under the Classic tier, I can now go utilize classes at Crunch Fitness in my area as well. So as long as the gym is available underneath the tier that you're enrolled onto, you can utilize any and all services at said gym. And it's still that one single flat copay. You're not paying multiple copays because you're attending gyms. It's just that one single flat copay. So again, it's a freedom of choice plan. If you're somebody that travels a lot, and let's say that you run into an issue where your gym's not where you're traveling to, well, maybe there's another one within your tier that you're enrolled onto that is. So again, it's a wonderful benefit. Highly recommend members to look into this. It's simple and easy to use. You can cancel at any time as well. They just ask for a 30-day notice. And there is a one-time enrollment fee of the $29. And then, of course, your affiliated copay for whatever tier that you select. But again, wonderful benefit, lots of amenities and classes available to you. So do check it out, especially if you're already paying for a gym membership. It'd be interesting to see where your gym falls, and maybe there's a benefit to you in there. All right, so here we have the Calm Health app. So the Calm Health app is a wonderful resource for support and for mental health. Um, the Calm Health app does begin with what we call a short mental health screening. And based on that screening, Calm will suggest certain programs that are available on the app. There's lots of great techniques for improving, your well-being. There's meditation, there's sound healing, there's soundscapes. Um, there's just a lot of there's goals that are provided, and then just a lot of support for your overall mind and body. So there's a wonderful app that again members can utilize through myuhc.com. you simply go onto my UHC, select Calm Health, and it'll give you instructions on how to sign up and start utilizing all of the benefits available through there. Optum and the Cairo benefits, Cairo and Acu benefits are available through Optum. This is always a favorite of members. Now, these benefits again are all available to all VEBA members. Um, And great thing about these benefits are there are unlimited visits available to you. Of course, that is subject to medical necessity, but however, it is unlimited visits. The copay for this, when it comes to the Chiron Acu, will match whatever your copay is for your given medical plan. So, or your primary care physician. So, if your primary care physician copay is $25 or $20, excuse me, it will be the same for the Chiron Acu benefits. It'll be $20 copay, and or a $10 copay. It'll be a $10 copay. So it is very simple and easy to utilize. You simply need to just locate a in-network chiropractor and acupuncture within the network and go to them, and they will do an overall assessment. And based on the assessment that they do on your first initial visit, they will recommend a given number of visits that you'll go for. And again, at the end of those visits, if they deem that you still need additional visits, then they will again recommend, and you'll continue receiving care based on, again, your medical necessity. If you want to verify if a specific chiropractor or acupuncture doctor is in network, all you simply need to do is go to my Optum Health Physical Health of CA.com. It is listed down there at the bottom because I know it is a long one. But you go there, and then there is an option underneath a plan product where will need to, in the drop down, select California Schools VEBA. And then once you select that, you can simply input a specific doctor's name, or let's say you don't have a doctor's name and you just want to search your area. Where's the closest person? You can put in your zip code, you can put in your specific address, whatever makes it simpler for you to provide or find the options available to you. You can input that in and get a list of the available chiropractors and acupuncture doctors. And if you're someone who doesn't want to do it on your own, you can also make a phone call into Optum, and they can search that information for you and give you the top results. So again, that is the chiropractic and acupuncture benefits. Here we go. Here, transferring to a new medical group. So we do know that during open enrollment or just in general throughout the year, sometimes it can be a little scary making changes. Transferring to a medical group. Let's say that you're transferring from one carrier to another, and you're new to UnitedHealthcare. You don't know what to do, what questions to ask, all through that process. We're always here to help, and we have multiple ways in order to help and tips in order to ease that process for you. Things like selecting a primary care physician. How do I go about doing that? What's the best? Who should I select? Answering those types of questions. Scheduling your first PCP appointment, which is the primary goal when you're changing plans. You always want to get that primary care physician first appointment out of the way as soon as possible, just to build rapport with your doctor and provide any, history that medical history that you want them to be aware of. So the other question with that is transferring medical records, prescriptions, any of that information. We're here to help. We have multiple resources, and we work directly with some of the medical groups to find the best ways within given medical groups to do that. Whether it's through their specific portals, how you can request it, how you can submit it, things of that nature. So we've shared a lot of that information, of course, with the VEBA advocacy team, who are aware of these processes and can assist and answer some of those questions. And of course, you can contact our member services team. Our member services team is also aware of this information and can assist with ways to, provide that information and give you tools in order to best make those decisions. Next slide. And of course, for any questions, we're always here to help. United Healthcare has multiple touch points and ways to get in contact with us. We do have a dedicated VEBA customer service team. That phone number there is the 888-586-6365. You can contact them. They're aware of all things VEBA, and we also train them on upcoming changes and things occurring for open enrollment, so that way they can best assist members throughout the open enrollment process. There is also the behavioral health customer service number listed there. These numbers are also listed on the back of your ID cards for members that are current members. In case you want to utilize them throughout the year, they're always going to be listed on the back of the ID cards. And then, of course, the website that I mentioned, the pre-member website, it's the yuhc.com, and then the member portal, the myuhc.com, where you can access all of your individual specific benefits available to you as a United Healthcare member. And with that being said, I appreciate your time. If there are, I'll be happy to answer any questions in the chat or in the end, and I will pass it on. Thank you.
Thank you, Nick. Appreciate that. Next, we're going to talk about your UMR PPO plan. So I'd like to introduce Rochelle. Rochelle, it is all yours.
Thank you, Matt. Good morning, everyone. My name is Rochelle Robuco, and I am your UMR Field Account Manager. And today I'm here to discuss with you your PPO plan. Next slide. Okay, so what we're noticing is many members, regardless if it was county or not, we're getting a lot of questions about where you can go to get the care that you need. So on this slide, you will see some of the quick care options that we presented to you. It shows you from the least expensive to the most costly options that are available to you. As you know, we always recommend that you always try with your physician's office first. Some of your providers actually also offer virtual consultations. If not, you can also use the teledoc, which we'll discuss further in detail at a few slides down the line. We also have the options of using convenience care clinics for minor injuries, rashes, pink eyes, or other preventative care services. And then, of course, there's the urgent care, which most of you guys are probably familiar with. And lastly, the emergency room options. We also offer the provider search and cost transparency. Many of our members are inquiring, like, what are my copays and things like that, or what are just the options if I wanted to see a specific provider or specific facility. As you can see here, you can search either by the network, by the provider's name, and kind of get an idea and view your premium designations. And also just be able to see what kind of options there are available to you. And we've noticed that members who does use this tool are able to receive care and have be able to save more money. As you can see, you can pay about 36% less by utilizing the search and cost transparency model. Next slide. One of the options that we want to also highlight is that as members, you have access to the UMR portal where you can have convenient access to your benefits. You'll be able to search for providers, be able to view your claims. You can even submit reimbursements through the portal. So we also really highly suggest that you register on the UMR portal to be able to get more, I guess, custom information to services that you're looking for or interested in, or just out of curiosity if you're wanting to know more about like maybe like meal plans and just things like of the sort. You can find a resources link on the UMR portal that'll be able to give you those options and just services, just questions if you have high blood pressure, diabetes. We have links that kind of gives you those resources to be able to look up and read more about. And of course, if you have more inquiries, we can check out the your UMR summary plan description, or SPD, that kind of details out how your benefit plans are supported under the UMR plan. Next slide, please. We also have the UMR mobile app or service on the go. It's another faster way for you to be able to access your information. I know not everybody's chained to their computers, so for those that are always on the go, you always have your mobile phone. You can basically be able to look up your digital ID cards, be able to look up a provider, and let's say you were traveling and you all of a sudden felt like, oh my God, like I'm not feeling good. Like I said, you have the option of physically going to like an urgent care or an ER, but you also have your mobile app to be able to look up those facilities and providers and services at the most closest convenient location of where you're at. And then you'll be able to chat or message through the UMR app as well on your mobile phone to be able to get some assistance. If you're kind of curious, you're in an area you're not familiar with and you want to know like, okay, if I was to go, what would be my deductibles and, out of pockets, things like that. Again, those are all available through the UMR mobile app. The one thing that we also did get a lot of questions on in the last year or so is that a lot of members are calling in and they're wondering why they're not able to see like the EOBs or if their spouse or other dependents have met the deductibles. And as you can see on the right-hand side of the screen, we do recommend that if your spouse or if you have a dependent that's over the age of 18, that they register online so that they have a profile that they can access on the mobile app or on the UMR portal. And then as the subscriber or the employee, they can simply give you access to be able to look up all that information. And as you can see here, it shows you that you would just simply need to go to the umr.com portal, access the account settings, and be able to do access privileges to allow the subscriber or the employee to have access to the spouse and or dependents that are over the age of 18 to be able to view their information online or on the mobile app. Next slide. So here is a brief snapshot of the UMR Select Plus PPO medical benefits. I forgot to put in that there are no benefit changes for 2026. So what you see here is just a quick highlight of the deductibles and out-of-pockets that's available to you and your dependents. So for your deductible for an individual, it'll be $300 for in-network and $600 for family. And for out-of-network, it'll be $600 for the individual, $1,200 for the family. It goes on to show you what your out-of-pocket is for your in-network individual is $2,300 and family would be $4,600. And for those that are out-of-network, it'll be $4,600 for the individual and $9,200 for the family. It shows you that for your office visits for in-network, it's a $20 copay per visit and $40 for specialists. And then if you were to go to an out-of-network, it'll just be 40% on the member's half or 60% is paid by the plan. And you can see on the right-hand side for inpatient, there is a $150 copay per admission for an in-network and an 80% paid by the plan after your deductible. And then it'll be $300 copay per admission if you were to be in an out-of-network facility. And urgent care is $75 copay per visit. Emergency rooms $125. And as you can see here, for the therapy services such as occupational, physical, or speech, it'll just be a $20 copay. But an annual unlimited visits will require medical necessity after 30 visits. And any preventative care screenings or immunizations is covered, so it'll be zero copay. And as I mentioned, your virtual visits through Teladoc or even through your provider would just be zero copay per visit. Next slide. So as mentioned, it looks like many have questions surrounding the coverage on fertility treatments, as Matt mentioned earlier in the beginning of the presentation. The mandate is primarily focused on fully insured large group health plans. So seeing that your PPO plan is under a self-funded group, there is no coverage for fertility treatment. However, you are able to get additional services through Kindbody, as Matt had mentioned earlier. And we're just basically highlighting that the only coverage on the plan is to diagnose the underlying cause or causes of the infertility. And pretty much under the general exclusions of the plan, it'll tell you what's not covered. So if you had to do a fertility test, like you said, those would not be covered under the medical PPO plan, but it will be covered under or through Kind Body. Next slide. Just like UnitedHealthcare, we also offer virtual visits. You have the option, like as I mentioned, many of the providers are now offering virtual visits or consultations, and this is with your PCPs. If not, you also have the option of doing teledoc. So this is a 24/7 physician assistance that you can call for any questions for general health or even specialty care for like dermatology or behavioral health. This is another way for you to be able to talk to a doctor in just in 10 minutes, anytime, anywhere. So for those that are traveling, or if you're on vacation and you have kids, they get sick while you're on your trip, this is another option that you can use to help get some assistance. And as you can see, there is you can go online to the teledoc.com, or you can call the 800 number at the bottom of the screen, and you can also get prescriptions filled at the nearest pharmacy, and you can contact them 24/7. Next slide. Another benefit that's available through UMR is mental health services such as Talkspace. So basically, Talkspace is another way that lets you get connected with a licensed therapist without having to commute or schedule do any scheduling hassles. You can basically regularly communicate with your therapist securely from home or while you're in the car. And basically, the Talkspace is currently available for individuals age 13 or older. There's also psychiatry services that's provided for those that are 18 and above, and you can receive support for anxiety, depression, PTSD, and you'll basically be able to register online and get a matching be able to get best matched to a physician or a therapist that fits your need. And they can basically, and if you don't like your therapist, you can also switch, and there's no additional cost for being able to switch. And you can do real-time face-to-face video visits with them. And simply, you would, like as I mentioned, you would just basically answer a few questions about yourself, and you'll be matched with a provider, and you can start your treatment right away with live sessions. And let's see, what else is here? You can also do I'm sorry, I've lost my train of thought. But as I said, Talkspace is just an easy way for you to be able to get in touch with the therapist. You can also look on the UMR portal for any behavioral health therapist if you'd like to choose that option. But this is just another option that we're giving you to be able to do some virtual visits. Next slide, please. Just like UnitedHealthcare, we also offer one pass select for our PPO members. And as Nick had mentioned, you have different tiers that you can register for. And there is just a one-time fee to register, but after that, the monthly monthly fee is dependent on the package that you choose. So we have about 5 options. There is also a digital option for those that just, prefer to just do videos from home. You have the classic, standard, premium, and elite. And this basically allows you to be able to, reach your fitness goals. With finding new passions along the way. You can try different gyms. I've tried this, and it's actually very helpful. There are days that I just need to do nothing but yoga, stretches, because there are days that we've been sitting very long, and that comes in very helpful. But you can also have access to thousands of gyms, again, for those that are traveling and you just need to get a quick workout. You can pretty much visit any facility that's within your hotel or wherever you're at to be able to attend some of these classes or just get a regular workout. There are no long-term contracts, as Nick had mentioned, and they're flexible. You also have the option of registering other family members or even friends at a 10% discount. So all you need to do is simply go to onepassselect.com and be able to register the information, and you'll be, I believe this also comes with a grocery subscription for a year, but all that information can be viewed on the onepassselect.com. And we make sure we just always remind folks to make sure you register through the portal, and if you're asked for your member ID, simply put that in to ensure that you're able to register through UMR for OnePass Select, because there are options for you to just register directly through OnePass Select. Next slide. Another feature that's available to you is a nurse line. This is a 24/7 option for you to be able to talk or chat with a nurse about any medical issues or concerns, and maybe even try to find out if it's something that requires you just to go to urgent care or go to the emergency room for. And they're available 24 hours a day, 7 days a week. And you would just simply go to umr.com and use the nurse line chat feature, or you can call the number that's going to be on the back of your ID card for the nurse line number, which is that 877-950-5083 number. Next slide. And lastly, we also want to give you all the options available to you on how you can contact UMR for any assistance. Our goal is to be your customer first, your one team and your team that will basically give you your not so standard service model. We're here to help, and we are able to do translations for many languages. Spanish for UMR customers, they're first representatives for that. We have 200 other languages that we can assist with if that's something that is needed. You can call the 800 number anywhere from 8 to 5 p.m. in all time zones. So for those that may be traveling outside of California, you'd still be able to access this. Again, 8 to 5. You could do a live chat or you can do messaging. And finally, if you're unable to get the assistance that you need through our UMR customer service, you can also contact your VEBA advocacy team who can assist with your services. And if they need our assistance, they have options of contacting us directly to be able to escalate some of the issues that you're having difficulties with. And I think that's about all I had for today. But if you have any questions, I will be here to answer any of your questions. And thank you for giving me time to speak with you today. And I
Thank
think
you so much. Yeah, thank you, Rochelle. I appreciate it. Next, we're going to talk about your prescription drug coverage. So I am going to turn it over to Amy. Amy, it is all yours.
Thank you, Matt. Hi, everybody. Again, my name is Amy Williams, and I am the Operations Director over here at Express Scripts. So I'm going to take some time today to go over a few slides to outline some of the key resources and key aspects of your pharmacy benefit that accompanies your UHC UMR medical plan. Go ahead to the next slide there. Great, thank you. Of course, first things first, right, is you are prescribed a medication, you want to know where the heck can you get it filled. So I wanted to showcase this slide here. Of course, the best place to go to for you to find your closest network pharmacy is going to be using one of our digital tools. So that's going to be logging on to either expressscripts.com or look for our free mobile app and download that. And there, this screenshot here shows, or this slide shows various screenshots of kind of navigating the Find a Pharmacy tool within one of those digital items there. So very easy to do. There is a drop-down menu. This, of course, is showing on the online version that you would look for Find a Pharmacy. You would go ahead and just type in your zip code to the closest, to where you reside, and it will be able to give you the list of your closest pharmacies. You'll also see that you're able to put in some constraints there as to what you're particularly looking for. Maybe you're looking for a pharmacy that fills long-term medications, meaning they can fill up to a 90-day supply. Maybe you're looking for a pharmacy that has vaccines available, because again, vaccines are something that are also covered underneath your pharmacy benefit. So whether you're looking for a local pharmacy that can fill just up to a 30-day supply, typically for those acute medications like an antibiotic, for instance, something that you don't take long term, or if you're looking for a pharmacy that can fill your long-term medications that you're stable on to get those 90-day supplies. And I'm going to touch on that on the next slide as well. But this shows you exactly where you want to go to try to find that. One quick thing I want to touch on here that is shown on the slide is, again, looking up to that prescriptions drop-down menu. That will just show you quickly on our digital tools more things that you can access and use at your disposal, right? You don't need to take the time to call anybody if you don't want to. You can go ahead and do some research here on these tools to also price the medication, find out drug coverage, things of that nature. So I wanted to call that out as well when you're in one of our tools. Go ahead to the next slide. Great. So like I said, long-term medications. So again, these are these medications that you are stable on. These are medications that you can fill for up to a 90-day supply and make it more convenient for you. So you have a couple choices here for underneath the county's benefit. You're able to go ahead and have your doctor, your prescribing physician, submit a prescription electronically is the fastest way to do this, over to Express Scripts home delivery pharmacy. So that's one option to add convenience for you. Free standard delivery straight to your door. You can manage, again, automatic refills and tracking, things of that nature on one of our digital tools. Your other option that you have with the county is you're able to visit one of your local pharmacies that are part of your long-term medication network. So that would be Rite Aid, Costco, or Sharp Reese Steely. So if you prefer to go that route, you certainly can do so, and it just will, again, minimize the amount of pharmacy visits that you would need to do for these long-term medications. So that's been an option for you guys for a couple of years now. So please feel free to take advantage of that. Okay. Credo is another pharmacy I wanted to speak to that's part of your benefit. Credo is a specialty pharmacy. So this provides personalized patient care for members with a wide range of chronic and complex health conditions. So a specialty medication is a medication that's typically used to treat treat conditions such as multiple sclerosis, cystic fibrosis, or cancer. The Credo Pharmacy team consists of our specialty trained pharmacists, nurses, pharmacy technicians, patient care advocates that understand and are trained in these conditions. So these pharmacists and nurses under Credo are available 24/7. The patients that take these medications receive one-on-one clinical support to help administer the medication safely, along with helping manage any side effects. Medication shipment on these drugs is handled with extra care, such as refrigeration as needed, and instructions on how to properly store these types of medications. And then one last thing I want to touch on here with the Credo and specialty medications is that some of these can be quite costly. So the Credo billing team is going to be one that is going to be able to help support you in your options around finding financial assistance programs that might be available with the drug manufacturers. So I wanted to call that out as well. Next slide. So getting these medications filled, getting these medications to process underneath your pharmacy benefit with Express Scripts. So you have a separate ID card from your medical side of the benefit. So this kind of showcases here a sample of what that might look like. But again, your information is going to be different for processing filling your medication than what you have on your medical card. So keep that in mind. Again, we also have a digital prescription ID card. This is from what you heard from the medical carriers. So you can access this on the mobile app and simply save that to your your phone's wallet to access that easily. You can also, once you log on expressscripts.com, you could print that ID card if you want a physical copy that way. That's very easy to do. You can also call your customer service team at Express Scripts and ask for them to mail it to you if that's what you prefer. But I know a lot of people have gone the digital route to make things a little easier. So that is, again, still remains kind of the best option for you for the pharmacy side as well. So resources for you, just kind of round up the last few slides of what I've talked about here. So again, of course, really encourage you to have kind of all the resources at your fingertips when you want to find the information that you need for your pharmacy benefit. So that's going to be logging on to expressscripts.com or getting onto our free mobile app. So please, if you have not done so already, very easy to do and to navigate those tools. I encourage you to do that. Also, you, of course, have your Express Scripts member services team. So that is at 1-800-918-8011. So you can reach out to them and talk to an advocate that is trained in your benefit as well and can help kind of get you in touch if say you want to get in touch with our coverage review team or be able to talk to a pharmacist, you know, in the comfort of your own home. That is also an option for you. And then you also have, as mentioned, for your medical carriers, you also do have your California Schools VEBA advocacy team. They have direct contact to us as your account team here at Express Scripts if we need kind of that extra touch, extra assistance with whatever you might be going through, whatever questions you have. So a lot of good resources are there for you. Next slide. Now I want to take the next few slides here to touch on one of the larger topics, right, that are on a lot of people's minds lately, and that is around the topic of GLP-1 drugs. So California Schools VEBA and the county, they participate in a pharmacy program here at Express Scripts called Encircle RX. So what that basically does, it allows coverage for county members to who need access to these GLP-1 drugs. So what are these drugs? They are glucagon-like peptide-1 medications. So they are a class of drugs primarily used to treat type 2 diabetes and obesity. They work by mimicking that natural hormone called GLP-1. So what that does is it will regulate blood sugar levels, appetite, and digestion. Some examples of these real quick to share with you. Example of these type of drugs for diabetes, type 2 diabetes would be Ozempic, Mounjaro, Rybelsus. These drugs that are used for specifically for weight loss and obesity is Wegovy and Saxenda. So I'm sure that's no surprise to you all, especially with what you see in the media, right? So through your benefit, in order to obtain coverage for one of these GLP-1 drugs, you must enroll and engage with the program called OMADA. It's an online lifestyle modification program. And there's more to come on that here and how to do that on the next slide. But I wanted to speak to, once you have enrolled and met the OMADA engagement requirements, the drug coverage settings on your account for these GLP-1 drugs will change from not covered to prior authorization required. So by engaging in the modification program, that opens the window for you to be able to obtain one of these drugs, where then your doctor would be able to do the next step of a prior authorization. So step by step here, I wanted to kind of go over kind of the first step in obtaining these drugs would be to engage in the program with OMADA. So again, how do you do that, right? Let's go to the next slide. All right. So through your, fill history and such, you will likely receive, if you do qualify to enroll in the OMADA lifestyle modification program, you'll get an invitation to do so. If you don't and you're curious if you're able to enroll in that program, here's a step-by-step instructions here on this slide. So you would, again, you'd log on to expressscripts.com. You'll see there's a tab called Health Solutions. You would click on that, and there you would see an access code if it is something that you are able to opt into and able to join that program. And each access code is unique to each individual. And then from there, you're able to go to Omada. Again, they are a vendor that Express Scripts uses. And by using that access code, you're able to enroll in that program. So there's a little bit there on kind of that next step. So let's show you a visual of kind of the little more of the flow to kind of continue the conversation on this and getting coverage for these drugs. So this slide kind of gives you, yes, it's busy, but I already talked about a bunch of this already. So I'll just, again, kind of continue my summarization of how to get coverage for these type of medications. So again, this is a visual of kind of the member journey. So let's say, you got your invitation to participate in Omada's lifestyle modification program, and then you're able to get enrolled with them, start the engagement with them. They will ship you a digital scale. You'll get on their app. You'll be paired up with a health coach, and you'll be educated about the program's groups and resources. You'll also be educated about what their program engagement requirements are. And so here it shows in bold, kind of in the middle of your screen there, what those are. You need to show that you are remaining engaged. You must weigh in 4 times per month on the digital scale, and you must engage with the app 4 times per month. And there's various, articles to read, as well as, your health coach you can message with and get ideas off of to kind of show that engagement with the app. Let's see here. From there, once you have kind of shown that you are meeting those engagement minimums, that, like I said on the earlier slide, by showing that you are kind of making these changes and giving your time to that, you're able to then look at getting coverage for a prescribed GLP-1 drug. So the next step would be for your doctor to submit for a clinical prior authorization. So it's clinical based. So that's through Express Scripts to get the prior authorization to get coverage for that drug underneath your pharmacy benefit plan. And so that would be your next step, is just to go through that PA process. And you're able to also follow that case for a prior authorization if you get approved or what the status of it is, again, on expressscripts.com or the mobile app. And then once you let's say you do get approved with that, you are prescribed your GLP-1 drug, you take that in conjunction with staying engaged with Omada to be able to remain able to take and be able to be prescribed those medications. You must stay engaged at the 4 times per month, like I just went over. Next slide. One more thing I want to touch on here before I leave you all, and I'll check for any questions in the chat, is around some of these other programs that are thrown out there here from Express Scripts. You might have gotten some various communications on this if it's something that touches medications that you take. So circling back a little bit to pharmacy options. Express Scripts Pharmacy, our home delivery pharmacy, has kind of created a branch off of that, a specific home delivery pharmacy that will only dispense GLP-1 drugs. And that is so that they are able to give additional clinical support to those patients that are prescribed GLP-1 drugs. So that home delivery pharmacy for GLP-1 drugs is called InGuide. So I want to make sure that you saw that. If it helps clear anything up for you, you will see kind of reference to InGuide home delivery if you are seeking to get a GLP-1 drug via that route. If you would like to get a GLP-1 medication through your benefit, you're able to also use your other in-network pharmacies that are close to you. If you want to get up to a 90-day supply, though, of these GLP-1 drugs, once you are, stable on them and stable on the therapy and want to get up to 90-day supply, again, you're able to use the home delivery InGuide pharmacy, or you'd be able to use the one pharmacy that is in your 90-day supply network, which is Costco. So I kind of wanted to end with that to kind of full circle back to your pharmacy options as it relates directly to GLP-1 drugs. And I believe that is the main things I wanted to cover today with you all. So I will take this time to take a look at the chat, and I thank you for your time.
Appreciate it. Thank you so much, Amy, for the wonderful information. Okay, we're going to shift gears a little bit. So now that you've been informed about the different plan options that are available, how to obtain your medications, we're going to talk a little bit about some of the expanded access to the CalViva resources that are available to you. So no matter what plan you're enrolled into, whether it's the UnitedHealthcare HMO plans or the UMR PPO plan, then this automatically means that you become a VEBA member. And being a VEBA member means you have additional benefits and resources that are available at no additional cost to you and your covered dependents. The first one's going to be with regards to the VEBA Resource Center. So the VEBA Resource Center we opened up back in 2019 in Mission Valley, and since then we've opened up additional locations. So first, what is the VEBA Resource Center? What is it all about? Well, really what it is it's an alternative approach to healthcare. We realize that, healthcare is not exactly one size fits all. What works for one individual may not necessarily work for another individual. But so we want to make sure that we treat each individual with whatever resources that they have available to them, whether it's through their medical provider or through the VEBA Resource Center. The VEBA Resource Center actually provides an alternative approach, which is more of a holistic type of approach towards healthcare, meaning we are not treating through medication, but we are here to support members with any well-being challenges that they may have, whether it's physical, emotional, social, emotional, it doesn't matter. We want to be able to provide you with, different resources that are available. So at the VEBA Resource Center, there's a lot of different resources that are available to you at our VRC locations. And so they include things like exercise equipment. There's ellipticals, treadmills, there's weights. I don't want you to think of it as pertaining to like just a gym or anything, but there is exercise equipment there to work on any type of physical strength. We have massage chairs there. You can also try acupuncture in your ear for the first time if you've never tried it. There are stress management classes. We have yoga. We have meditation classes. There are all types of, sound healing classes, and even our most popular, which are cooking and nutrition demonstrations that we have from our very own chef Leslie. She is absolutely phenomenal. She makes very delicious and nutritious recipes. So if you are looking to improve your diet, then she has so many great recipes that you can take a look at as well. And so it's really easy. All you do is go to VEBA Resource Center. You can go ahead and sign up for any of the classes that you want. If you want to pop in, there's certain nights where you can come in and use the exercise equipment, or if you want to access the massage chairs, things like that, you can just simply sign up and make an appointment and come at any single time that you would like to. Now, we do have different locations that are available currently right now. At this time, we have our Mission Valley location, which is located on Hotel Circle South. And then we have one on Ruffin Road, which is in Kearney Mesa. So this is literally one block south of the County of San Diego's main office building. So it's just one block down the street that's available. And then you have our small satellite location in Carlsbad, which just has some consultation rooms and our massage chairs. It doesn't have all the additional benefits like the exercise equipment, the cooking demonstrations, things like that. But I am excited to announce that we are going to be opening up a new location in Chula Vista in the first quarter of 2026. I don't have the exact address, but from my understanding, it's going to be right off of like H Street and Broadway. So right in the middle of where their downtown location is. I believe there's medical buildings that are surrounding that area as well. So it makes it really convenient for all of our members that live in the South Bay region. We have a lot of VEBA members that live in the South Bay region. So we definitely wanted to make sure that we had access to a VEBA Resource Center. So we will be opening that up again in Q1 of 2026. We will provide you with the exact location, the date it's going to open, and then you'll be able to see all the different types of services that are offered as well. Through the VEBA Resource Center, you do have access to our care navigation program. Our care navigators are basically nurse practitioners, and they can work on individuals one-on-one with, any type of support that you may need, whether it's, again, physical, mental, social, emotional, it doesn't matter. They are here to work with you because, again, healthcare is not one size fits all. What works for one individual is not necessarily going to work for another individual. And so if you do want to work with one of our care navigators, you can simply go to VEBAresourcecenter.com. You can go ahead and request to speak to a care navigator. They'll have an initial consultation with you. They can do this in person, or they can do it over the phone with you whenever it's convenient for you, and it's free and it's 100% confidential. Should you decide to move forward with your journey on utilizing the VEBA Resource Center, we do have our new whole health coaching program, which basically takes all aspects of overall well-being. As you can see in the pie chart here, there's 8 different dimensions that we consider part of, being healthy in a holistic type of a form. And so I'm not going to read each one of these that are available, but what we've realized is that where someone may be lacking or in one area, they may be striving in another, or vice versa. So maybe you have someone that's really great about eating healthy, they're really good about physical activity, but maybe they have a hard time communicating, with their environment, with their workplace, things like that. We want to make sure that you have all the resources in order to live your happiest and healthiest life. So we've put together a 6-week program that you can take part in. You would just speak with your care navigator, and as you want to move forward into the whole health coaching program, then we will go ahead and get you enrolled into that program as well. Also, through the VEBA Resource Center, we do have navigating life transitions. We understand that sometimes, there are some big moments that are going to be major impact changes in your life. And we want to make sure that you have the ability to have additional support. This could be like if you're preparing for marriagehood, or you're expecting your first child, any unforeseen challenges that you may be having. Maybe you're going through a divorce, or maybe you lost a loved one. We can absolutely help you through that process. And so if you would like to speak to someone, you can always reach out to the VEBA Resource Center, and we will make sure to get you in touch with someone for any of these type of life transitions that are available. And then our Cooking and Nutrition Hub. Finally, our Cooking and Nutrition Hub. So basically, I had mentioned that there are healthy cooking demos through the VEBA Resource Center. We want to make sure that you have a healthy diet, and so we do offer a abundance of different cooking and nutrition classes that are available. The recipes are absolutely delicious. I don't know how our chef Leslie does it. Somehow she can take broccoli and make it taste like bacon. But you can take a look at all the different resources that are available through there, and feel free to cook them on your own. You can take part in the classes. If you want to come to one of our physical cooking classes, you can do so and take part in it, and you can try the food. It's absolutely delicious. And then finally, before we conclude, I'm going to talk a little bit about the additional benefits that you have being a VEBA member. So again, as I mentioned before, whether you enroll into the UnitedHealthcare HMO plans or the UMR PPO plan, then that automatically means that you're a member with VEBA. And being a VEBA member, you have additional resources to you and your dependents at no cost. So the first one's going to be our advocacy department. Our advocacy department is probably one of my favorite departments that I work with pretty much on a daily basis, and they're really here to advocate for you. There's a lot of times where it's really difficult navigating the healthcare system. Maybe you're contacting your carriers, you're getting bounced around from phone tree to phone tree, you're not getting your questions answered. That's exactly what advocacy is here to do. They are here to help you with any information that you need pertaining to your benefits. And so that can include, what plan you're enrolled into. If you're maybe thinking about changing plans this year, we can go over, who are the different providers in that plan, what the different out-of-pocket costs are, things like that. You can also talk to them for any billing related issues. So maybe you received a bill in the mail, you're not exactly sure why, you thought it was covered under your plan. They can take a look and see if, that is covered under your benefits, or if that's a separate bill. Maybe you need assistance with access to care, the quality of care that you're receiving, or maybe you're having a hard time getting a referral pushed through. You can reach out to them. They're available Monday through Friday from 8 a.m. to 5 p.m., and they will be more than happy to answer any questions pertaining to your benefits. Teladoc medical experts. is a second opinion program. You know, maybe you've been diagnosed with a chronic condition, or maybe you need to undergo surgery. And before doing so, you want to get that second opinion or that second peace of mind. Well, that's exactly what Teladoc Medical Experts does. Basically, it's really easy to get started. You can go to their website or the 800 number that I've provided below. You'll have an initial consultation with them, and you can talk to them about whatever it is that you're maybe going through. I'll give you an example. So let's just say I'm someone that I need to have a knee replacement. And before I have that knee replacement, I want to make sure that I'm doing the right thing by getting the right surgery. So I can contact Teladoc Medical Experts. I'm going to have that initial consultation. I'm going to let them know, hey, I've been advised I need to have a knee replacement. I want to make sure that the surgery I'm about to have is best for me. What they're going to do is, with my permission, they're going to access my medical records that I want to share with them. So that could be conversations that I've had with my doctors or my surgeons. It could be any lab work or MRI, PET scans, whatever that may be. And they're going to take that and they're going to take that information and send it up to one of their 50,000 world-renowned doctors. They're going to look for a doctor in the area of expertise. So in my case, they're going to send it up to one of their world-renowned knee doctors. And I'm going to have a consultation with them and see what their findings are. Am I getting the right diagnosis, the right prognosis, the treatment options that are available? You know, maybe that knee surgery I'm about to have, maybe it's an outdated surgery. Or maybe they found out something completely different and I don't exactly need to have surgery. But what they are going to do is they are going to give me that second peace of mind so that whatever decision I make moving forward, I know that I feel like I'm making the right decision. Again, this is no cost for you and your covered dependents. Not only do we want to take care of you, but we want to take care of your four-legged fur babies as well. So if your canine or your feline is taking any type of medications, then there's a good chance that we can save you some money on those medications. It's really simple. It's through Inside RX Pets, and you just simply go to insiderxpets.com/pets. You're going to go ahead and fill out your registration to where you can go ahead and print out an ID card, and then you can take it to one of their 40,000 different participating pharmacies. You just show the card and you can save up to 77% on generic medications, 15% on any type of brand medications. I did check, unfortunately, flea medication is not included in this, but if your pet is taking any type of medications, there's a chance you could save some money. We always want you to stay connected with us at VEBA, what's going on. So we are on all the social media platforms. So feel free to connect with us. You can stay in tune with what's updated with VEBA, what's changing, things that are happening with our VEBA Resource Center. So we are connected on all social media platforms. And then if you just want to stay in the know, we do have additional information at VEBAonline.com. This includes our carrier information. So if you need numbers to our carrier partners like UnitedHealthcare and through UMR or Express Scripts, all that information is there. You can get through to our VEBA Advocacy Department as well as to the VEBA Resource Center for all the information that is available surrounding being a VEBA member. And with that being said, that concludes our presentation. We do really appreciate your time here today. I know that was a lot of information to go through. We do want to hear your feedback, whether it's good or bad. We're always looking to improve anything that we can do to improve the communication, how we provide open enrollment. We would love to hear it, and what you also love to hear about it as well. With that being said, I am, again, your dedicated account manager. So if you do have any questions, you can reach out to me anytime. I'm more than happy to assist. And with that being said, that concludes our presentation. We'd like to thank you so much for joining us here today. I'd like to thank the County of San Diego for allowing us to be here to present. And I also would like to thank our carrier partners with Nick, Rochelle, and Amy for being here. We appreciate you. At this time, we would like to go ahead and open it up for any questions. So I'll go ahead and stop sharing my screen. We'll go through the chat on any questions that you may have. Feel free to put them into the chat, and we will be more than happy to answer them. And let's take a look here. So Nidra, I'm not sure if a lot of questions were already answered or if there were or where we'd like to start?
Yes, we have been answering a lot of questions in the
Okay.
chat as we've been moving along. But for anyone else who missed an opportunity to ask a question, please do put it in the chat. We're happy to spend some time with you and answer those questions. Scroll to see if we missed anything. Questions. Matt, you may have answered this one kind of randomly during your portion of the presentation. We have an individual who mentions, I called United to inquire about switching my current insurance, but they can only provide information to existing members. Is there another number I can call?
So this member is not
currently.
I was going to say this member's not currently enrolled under the County of San Diego's plans, and they're looking to switch over to one of the county plans.
Yes, that's my interpretation of the question. Yeah.
Okay. Yeah, you can contact our VEBA advocacy department. I can put their information in the chat. Basically, just let them know that, hey, I'm going to be employed by the County of San Diego. I understand that I'm going to become a VEBA member. I just want to understand my plan options that are available. If there's a certain doctor that you want to see, then we can take a look and see which medical group that the doctor is tied to. More often than not, that will determine the plan that you're enrolling into. But yeah, we can absolutely go over the different plan designs. So I'll put the advocacy information into the chat feature. You can reach out to them. They'll be more than happy to speak to you. Great question.
Moving right along. Let's see if I missed anything else here. And if I did, I apologize if I've missed anyone. If we don't get that question answered today, do know that the Benefits Division and your benefits ambassadors are available to answer questions during this open enrollment period as well.
Nidra, I did want to add to the last question you answered with regards to Sharp and Sharp Reese Daily. They're also available in the Harmony High Deductible Health Plan as well. They're both available in that plan as well.
Excellent. Thank you, Nick.
Nidra, I did see one question with an explanation of the mental health benefits other than Talkspace. So we do have resources at the VEBA Resource Center where you can access all the resources that we have. But I believe, if I'm not mistaken, Nidra, the County of San Diego has their own employee assistance program separate from what is offered at VEBA. Are you able to provide a little more information on that?
Absolutely. Yes, all county employees do have access to EAP, which is monitored by Anthem EAP, and I can put that in the chat as well. So if you want to access the services, they're available to yourself, any family members in your household, even roommates or domestic partners. They have access to the services through EAP as well. So let me grab that link and put that in the chat for you all. And with that, so just a clarification for the individual about the EAP. Sounds like you're specifically interested in mental health through the medical plan. Is that correct? Yes, that is correct. Okay. Matt, can you elaborate a little bit more about services under the medical plan for mental health or counseling? And I'll see if I can find some information
Actually,
on the
Nick,
website.
Nick, is that something that you're able to address, like what the mental health services are? I know that you pay a copay if you go through your provider, but like the different services, how members can go through their provider in order to access mental health services?
Yes, so in order to access mental health services, members can, it's actually, it's self-referral. You don't need a referral from a primary care physician for that. You can locate a network therapist, or a psychologist, whatever is needed underneath the mental health benefits, directly by going to, there's a website and I can put it in the chat. It's liveandworkwell.com. And that website is where you can locate all of the in-network physicians that are available underneath mental health benefits. As far as the coverage, there is, a standard benefit guide that can give you an idea of what's covered underneath the plans. Um, but the services are 100% available. You can find all the in-network doctors on that website, as well as a bunch of other tools, guides, brain sharks, a lot of different resources on that website for mental health benefits. And it is an Optum website, just to call it too. So it will be an Optum benefits underneath the for the plan.
Nick, I have another one for you. It looks like we had an individual that was accessing an adult physical exam where the plan shows no copays for preventative care under the VEBA Alliance plan. However, they were billed $25 copay for each time that they visited that. Can you elaborate to when, how preventative care is at no cost, but then, if there are certain services, then your primary care office copay would take effect?
Yeah, so I mean they're absolutely right. Preventative care should absolutely be a zero copay when you're receiving any preventative care. However, there are times where maybe you receive um, other services at the point of that visit where they may bill for that copay. In all honesty, in these specific situations, the best way is to contact member services or the advocacy team and have them take a look at the overall, the bill that you received, to try to help you understand what they may have billed for. If in fact you were billed a $25 copay for preventative services, then we can certainly reach out to the medical group in hopes of rectifying that claim, so that way it should be zero copay. But typically, when that occurs, there were other services received at the time that rendered the $25 copay.
Thank you, Nick.
I see that we have Irene is having some challenges with the directory for the Optum acupuncture and chiropractor. So hopefully now you'll be able to access the information in a list. Let us know.
Looks like so far, Nidra, we've answered every question that's come through in the chat. Again, if anyone has any questions, please feel free to reach out. We're more than happy to answer any questions.
Perfect, Irene, it worked. Glad to hear that. And as a reminder for everyone, you're going to see quite a few reminder emails regarding open enrollment. Again, open enrollment is your opportunity to make changes to any plans, add or remove dependents, even if it's not a qualifying life event. And our benefits ambassadors are available for you to guide you through the process, as well as to answer any questions. My benefits team, I'll say we are an awesome team. We're also available to assist and answer questions. So if you give us a call or send an email to the main benefits inbox, we can answer questions that way as well. Another opportunity to discuss your plans with us as far as the benefits team, we will have one-on-one sessions where you can schedule a 30-minute time slot. Again, that's one-on-one. So if you have some confidential issues or matters you wanted to address, we're available for that as well. And those, the schedule will go out in a couple of weeks for you to lock in a time slot. Well, team, I don't believe we have any more questions coming through. And I do want to thank Express Scripts, VEBA, and UnitedHealthcare team for making time today to go over all our plans. I know it's a lot of information, everyone, but again, we're happy to help. And this concludes the seminar. Thanks again for joining us.
Thank you so much, everybody.